Hair transplantation is the best way to permanently restore your hair and overcome baldness once and for all. But your results won't appear overnight, and even the most successful hair transplants undergo a period of shock loss after the surgery. Hi, I'm János from Hair Palace Hair Clinic, and as a patient coordinator I've accompanied the treatment of more than 1,500 patients in the past 5 years. Today I will talk about the dreaded shedding phase that patients go through after the procedure. The shedding phase is an important part of the recovery process after a hair transplant. During this period, the newly transplanted hairs will fall out, leaving the implanted area thin. As the hair is usually cut short beforehand, the patient may end up looking more bald than he did before the procedure. But there is nothing to worry about, as this is normal and essential part of the recovery process. The shedding phase usually begins 3 weeks after the procedure and can last anywhere from 2 to 4 months. During this time, you may experience excessive hair loss and shedding. The shedding phase is the result of the body's natural healing process. The transplanted hairs enter what's known as the telogen phase in the hair growth cycle. This is when hairs stop growing and separate from their hair follicles. This is shortly followed by the exogen or shedding phase, which is where the most of the hair loss occurs. As the implanted follicles shed, new hairs will begin to grow in the transplanted grafts. This process actually signals that the transplant was successful and new hair growth is slowly starting to emerge. But it's important to give the transplanted area time to heal and for the new follicles to take root. You must be patient during the shedding phase, as it is necessary for the new hair to take hold and begin growing. You may look like an ugly duckling for a couple of weeks, but this is fairly a small price to pay for regaining your full head of hair. The shedding phase is eventually replaced with the growth phase around the 3rd month mark. By the 4th month, you may see improving density and your bald patches will slowly begin to get filled up. In addition to being patient, it is also important to practice good hair care. This includes avoiding harsh chemicals or products that could damage your follicles. You should also follow a healthy diet and get enough rest. While shedding is normal, you should always consult with your doctor if you experience any itching or redness. These symptoms could be signs of infection and should be treated right away. In conclusion, the shedding phase is an important part of the recovery process after a hair transplant. During this time, you may appear bolder than ever, but it is important to be patient, as this is only a temporary hurdle. It is also important to consult with your surgeon if you experience any unusual symptoms. With patience and good care, you can look forward to a full head of hair within just 15 months. Did you experience any shedding after your hair transplant? Tell us about this in the comments below. And if you enjoyed the video, subscribe to our channel. We post new videos every week, so you can take a look at success stories and learn more about hair restoration methods that can help you overcome hair loss once and for all. Thank you for watching.